So after Vietnam, I applied to college. I couldn't get in. I got rejected all because I only had a GED, and I had no SATs or PSATs or anything. Thank you. PSATs or SATs or anything like that. So I did apply and got rejected, so I thought I would stay in Special Forces my whole career, but my colleagues said you should apply. I did. But then I got an acceptance to Bronx Community College, and they had open enrollment for any Vietnam veterans. I went there. It was a very humbling experience. And my trajectory changed from an active serviceman to a reservist, and then I held these many jobs. And, you know, I've been a police officer, a paramedic, a registered nurse, a PA, an ocean lifeguard. And as you've heard from Michelle, you know, a lot of people think that's pretty cool. A lot of people think, well, he's just a guy who couldn't keep a job. And probably there's some truth in both of those. But every one of those jobs later on became essential in the complex world I inherited as Surgeon General to truly understand how to communicate to people and how each of the levels of society function in this mythical integrated system that we always talk about, and the importance of each one of these people in how our systems work or don't work. I went on to medical school, working those jobs, and I was fortunate to went to UC San Francisco, which those of you know San Francisco in the mid-70s, it was a melting pot of everything. The UCSF Medical School is just a few blocks from Haight-Ashbury, so we had one of everything in the class. Okay, 150 students, the youngest being 18, who already had a master's degree in math and chemistry and science, some other science, and then a bunch of us who were Vietnam veterans that were a bit older, and the oldest person being 39 years old. 150 melting pot. And we spent a lot of time at San Francisco General, which is maybe one of the most diverse hospitals in the country. The trauma center, and in that community, over 100 languages and dialects spoken. People from all over the world. So again, I'm immersed in what we call health literacy today, but back then, health literacy was defined as, I need an interpreter, okay? I can't understand what these people are saying. The fact is, we know that health literacy has gone far beyond interpreters. It really is a cultural understanding. It really is putting yourself in the shoes of those people who see health and wealth and ideology and theology much different than we do. I went on and trained as a general vascular surgeon, as you heard, and I'm happy to say I'm a recovering surgeon. And I say that because I know most of you who are in healthcare, if you've worked with surgeons, if you ask a surgeon to name the best 3 surgeons in the world, they always have trouble naming the other 2. And so, I resonated with some of you. So, you guys back there work with surgeons, right? But on the other hand, you know, do you want to go to the surgeon that's only the second best in the world? An interesting anecdote, because, you know, having been a nurse where, you know, nurses see the world very differently. And one of the best parts of my education throughout the years and work experience was being a registered nurse. Because physicians tend to see patients in terms of chief complaints. It's getting better now, and I think medical schools are doing better and more sensitive. But certainly when I went through, it was a chief complaint. Figure out what the problem is and move them on. A nurse looks at a patient in totality. A nurse looks really at the environment, the family, the work areas, and tries to figure out why this problem occurs in the context of the bigger picture. So when you put the two together, you really have truly a holistic provider, nurses and docs working together. Well, I used to spend a lot of time with my patients. I used to talk to them a lot and try and learn that. And I was admonished repeatedly by many of my surgical attendings. And then one day I got an attending who really gave me a hard time. And I used to argue with him because he would be telling me stuff. And I said, look, I don't want to mention his name now because he's a pretty prominent guy. He may come back at me. But you know, I'd say, you know, if my mother failed and the Army failed, maybe you should stop trying to make a man out of me. Okay? And I'd say, I need to do this. And he'd say, you're spending far too much time with those patients. Figure out what the problem is and you move on. And one day he burst out at me and he said, you know what? You're not fit to be a surgeon. You should be a pediatrician. And I said, oh, you know, hurt me a little bit, but, you know, I've been beat up pretty good. I'd been in the military, and I moved on with it. Years later, as Surgeon General, I gave the keynote address to the American Academy of Pediatrics, like 10,000 pediatricians at some big convention center. And I recounted that story to them, and I told them, I said, you know, I was accused of not being right for surgery, and I was spending too much time with my patients, and therefore I should be a pediatrician. And I got a standing ovation. They all clapped. The pediatricians all got up and clapped, you know. And I said, well, that was great. But it was true, but it was part of my understanding, really understanding the patient. So, going on to become a professor, and now you're teaching. But you have to teach in a health literate, culturally competent manner. You teach diverse classes. You teach in the community. You try and resonate with your patients. I moved on then into public health, as you heard, because a lot of what I was doing, running trauma and emergency medical systems, I realized was preventable. I went back to school. I got a master's degree. And I started running a county health system, which is right near the border in Arizona, and usually diverse population, lots of cultural barriers. And again, I found myself immersed in having to communicate with diverse populations and trying to give them good information to keep them healthy. So again, in every step of my life, being challenged with this concept of health literacy.